left them behind. Expiry date. Okay? Right, now we have this gamma finder where we use in theatre and also in the nuclear medicine, where we try and identify the lymph nodes. Okay, so basically in the nuclear medicine suite, the doctor will inject the radioisotope material and do the marking, right? On where, identify the lymph nodes and mark it on the skin, and also there's a picture. And later on the same day, usually the patient will come to theatre where we'll now inject the blue dye, okay? And then try to identify the lymph nodes, okay? Now the good thing about lymph nodes is that they have valves, so the flow is one way, okay? They do not go back the reverse, so it's forward. So when we do the surgery, we use the gamma probe over the skin to plan our incision, right? And try and identify the lymph nodes. And also we try and look for the blue nodes, all right? To try and identify the lymph nodes. As I said, it's very important. You must get the correct lymph nodes, you see, because otherwise you'll be not doing the patient a favor. So that's how a sentinel lymph node looks. It's blue, like that. A normal lymph node is usually tan colored. It can be tan or fatty colored. That means maybe like this. That's a normal lymph node. So compared to blue, usually it would be obvious. Okay. So you will identify those lymph nodes and take them out. They go to the lab. And they will be sliced up by the pathologist and reported as in whether there are cancer cells in them or not. Okay? Right. Now, I did mention a bit about lymphedema happening, and this can be as a consequence of cancer itself, can be a consequence of surgery, it can also be a consequence of radiotherapy. Okay? So when it happens, what you need to do for the patient, they need to see a physiotherapist. Okay? And they can perform massage, pressure, crab bandage, or something called lymphopress. Now, depending on the severity of lymphedema, if it's mild, it can be temporary, transient. If it's very gross, it's permanent, right? And there's no way you can reverse it. You can probably control it, but you can't reverse it. So one of the ways is actually to prevent it. And I normally tell patients who've had axillary dissection, you know, the typical where they have a larger part of the lymph nodes involved.
Really helpful. I know you have your evaluation forms, but we'd like to do a summing up of the information and have you complete the evaluation forms just after we do that. I don't even know. You're loud. In a good way. Well, okay, I'll be loud then. I don't. So what I'd like to do is we have 3 groups, and we thank both the group members and the moderators for each group, the facilitators. I found them really interesting for me to listen into. And not only that, but each of the groups were talking a little differently. And I think you'll see that when people are explaining it. So I'm going to ask Alicia, would you introduce our person who's going to speak for Group 1? Oh, there you are. Oh, I'm sorry. And I bullied her into doing this. So I'm sorry. Thank you for doing this. But we were Group 1. And where are the successors? Me and Rose. Excellent. Wonderful. Good teaming. Baca semua. you need the mic? No, okay.
What are we supposed to do?
Oh, I'm sorry.
Yeah.
Just read this one.
You can present the poster, or you can talk about some things we spoke about in our group, just briefly.
Okay, alright. Okay, we from group 1. So our discussion just now is about, the first question is, what brought you to this workshop?
Okay, from our discussion, okay, one, we can have a lot of apa Mariani?
Since somebody else wrote this, you don't have to read all
Okay.
this. Just talk about the big ideas. The big ideas. about
Berterusan, hasil
Okay,
daripada
evaluation lah,
Okay,
for our
evaluation.
decision.
Okay, so our evaluation from our discussion just now is from group 1. Our evaluation is there is a great need to be more educate ourselves in order to help others. It means that our Malaysian citizen, our stigma, especially Malay, we lack of knowledge regarding cancer. And then when somebody is diagnosed to have a cancer, normally we will deny it. We will deny it at the first stage. We will deny it because it's hard for us. Because cancer, when we is diagnosed to have cancer, is related to death. That's the stigma of Malaysians. So we have to educate our people to give more information about cancer. Not only for breast cancer, it's all types of cancer. Okay, and also in our setting, our hospital setting, we have no information center. For information center for breast, for cancer, we have no center for that. We only have a general information center. So when patients come to us to get knowledge, it's quite difficult for us as a nurse, as a health caregiver, to give information for them, and they also don't know where to go. So from the discussion just now, we think our group think it's important to have center in our hospital,
And we must train a lot of nurses for the cancer, because for center for information cancer we need the trainers.
it is important to educate ourselves first before we can give information to others. That's all.
That's all.
Thank you very much. Group 2, please. Me. All right.
Are you? Our presenter is Dr. Abdullah for Group 2.
Dr. Rani.
Dr. Rani.
PhD in anthropology. Okay, thank you very much. First, I want to thank my group, who has been very, very active, especially the young nurses, Marshilla, Noriza. Thank you. Even though you tried your best to help us in understanding how the young people should be able to help the cancer patients at hospital. Ajarokia, you're very, very, very dynamic in the group. And of course, Sadua, you're finishing your degree. I hope this will help you. Okay, what we agreed what the group 1 has said. You know, there's really a heavy stigma. When you say the word cancer, it's equivalent to death. It's especially among the Malay community. I'm not very sure about the others, so I can't talk so much. But normally it's associated. When you say cancer, it will lead to death. But of course, people should know about surviving it and not getting there very fast. What we want is that they don't get there fast, even though it can happen very fast. Our group discussed about truth telling because there's an occasion where the father was very, very ill, very old, was diagnosed as having stage 4 cancer, and the son would tell the doctor or instruct the doctor, please don't tell my father that he has got 4-stage cancer. But our feeling is that you have to tell the truth to the patient, because at least to give him time to prepare for what the eventuality that will happen. Okay, akan berlaku kematian. We got to prepare the family for that. Okay, we don't want the family to fight while you're not even gone yet, because so allowing the patient to do that and learn about the disease. If it is stage 1, stage 2, doesn't matter, but we have to allow the patient to learn about the disease and how he can sort of slow down, you know. And secondly, support from doctors, nurses, this everybody will agree. Group 1, 2 and 3 agree. You know, we are talking about the hospital doesn't have centers, but I think it's very, very important. Even the hospital must know where to get source of information. I wonder whether if only Putrajaya knows about can help or care. We want the hospital at Kota Baru to know that there is care here, and other places, hospital in other places, or the remote places know that there is care at UPM. So that information must be made available. This is where I come into it. Number 3, access to information. It's not just to cancer patients, but to all hospitals. So I think care, we have to find ways of how we can bring resources to care so that they can produce more booklet or resources, resource material so that we can distribute to the hospital. So that we can, the outreach will get to the relevant patients. Okay, cancer awareness as I relate is, I would like, since Prof. Mazna is here, and I would just like to mention that we have a new Vice Chancellor. We just appointed about 3 days ago. And I heard something about he wants to revive Permata. Because Permata was not active. Permata is a women's group. It has not been, it's been active, yet